Afternoon, good evening, ladies and gentlemen, and thank you for taking some time to come here this afternoon to listen to a very personal story. It will unfold before you. It will take about 20 minutes, then we'll have an opportunity for questions afterwards. My name's Brynn Gaskill. I'm currently working for an organisation called Virgin Care. It's the Virgin Healthcare arm of the Virgin Empire. I've been with Virgin for about 3 years now approximately, and I'm responsible for statutory and mandatory training within that organisation, vocational training and management development. My story will unfold as follows. I'll tell you a little bit about Virgin Care. I'll tell you about our value chain. Importantly, why we were looking for a new learning management system. I'll talk to you about the procurement process that followed that. I'll tell you why in particular we chose Totara. I'll tell you a little bit more about the partners we worked with. They're called Chambury Learning Solutions, and the level of support that they gave us going forward. Rhetorically, I will ask a question: did we get it right? Was our process right? And just as importantly, what did I learn? What did we learn as an organisation post-implementation? And then we'll have some questions at the end.
When I was 17 years old, I set up a centre called the Student Advisory Centre to give free advice and help to any young person with any problem. Over the years, we've had quite a lot of involvement with healthcare, particularly in Africa, where we've set up clinics and tried to tackle some of the bigger problems like HIV and AIDS and malaria, TB. I think, using our entrepreneurial skills, it is possible to improve healthcare in the UK and yet save the taxpayer quite a lot of money. Our attitude in running an airline is it's got to be safe and make sure you've got the best pilots, you've got the best engineers. But once you've ticked all those boxes, it should be fun and it should be an enjoyable experience. And I think the same applies to Virgin Care. Make sure you've got the best, make sure you've got everything sorted, but make sure you deliver it in an enjoyable way. Anybody going to a clinic, they're going to be feeling awkward, difficult, and so it's incredibly important that when they go, they feel welcomed, warm. So we need clinics out there that are warm, welcoming and friendly, so that people can be treated properly, get great value for money, and the government can offer a much better service to members of the public.
So that was a little bit about Virgin Care. Just to summarise what Richard Branson was saying, essentially what Virgin are doing right now is we are competing for National Health Service contracts. We've won circa 350 so far. So the fair chance if you walk into your local minor injuries unit, sexual health clinic, podiatry clinic, it's possibly being run by Virgin Care on a 5 to 10 year contract. That's what we're about. Why we're doing it is really quite simple. We think we can do it better, more effectively than what went before. We think we can do it cheaper, that's for sure, but we definitely believe we can increase the levels of service that we give to the end patient. We want a great experience for everybody, not just the patients, but relatives and friends as well. We think evidence shows that we're delivering better value for money. Not on every contract, but on 95% of contracts right now, it's showing that empirically. And our values I want to talk about essentially speak for themselves, but in terms of the learning management system and what I want to talk about in a few moments' time, striving for better definitely resonates. We had to think of challenges, we had to learn to improve the way we worked, and if you look to the far right-hand corner, the team spirit thing we certainly had to have a level or degree of resilience. This thing wasn't straightforward, so I point to the resilience because it's something that you have to have when you're undertaking a project of this magnitude. Why were we looking for a new learning management system? It's quite simple really. The one we had, and I really don't feel comfortable naming it right now, but the one we had was essentially 12 years old. It wasn't working. The people that supplied the LMS were kind of disappearing rapidly. The levels of support I required for myself and my team just weren't there. Users would say to me, Brynn, I'm new to the organization, I need to do my statutory and mandatory training. How do I enter the learning management system? To which my admin team would send them a document that was 27 pages long. Yeah, it wasn't working. Myself, 3 years ago, I was new to the organization. I said to my admin manager, how do I access the learning management system? She said, sit down, we have a document. I'm not going to give it to you, but it's complex, it's convoluted. We wanted something that was more intuitive. Users weren't happy, they were feeding back to me their frustrations, and I think it's really important if you're an organization that needs to measure compliance, that a user can go onto the management system and at the click of a button find out what their compliance levels are. We couldn't do that. To get that, I had to receive a phone call from users, and we've got about 6,000 employees in Virgin Care right now, so my team were handling myriad phone calls just to answer simple questions around, what have I done and what have I got to do, Brynn? It clearly wasn't working. With regard to point number 8, we have someone specifically appointed within Virgin Care to produce reports to give service line and business unit level to aggregate by organisation a report. That was taking 24 to 36 hours to compile. So clearly, what we had was unacceptable. We went to the marketplace. We looked at 6 potential suppliers. I think just about all of them are here today. We looked at a bunch of criteria that were important to us to say the new learning management system has got to do these things. We wanted it to run on smartphones and tablets. The previous one didn't. We wanted the users not to be referencing a 27-page document to get onto it. We needed it to be, the word we used throughout the experience was intuitive, i.e. you log on and it will take you to the learning material without too much fuss. The reporting functionality had to improve in terms of the time taken to deliver reports, and we wanted users to be able to access a variety of learning interventions that we'd put together, i.e. PowerPoint presentations, access to policies or documents, or simple Word documents, or it could be Storyline Articulate that we've developed, but we wanted that pathway to be clear and accessible. And finally, a particular concern of mine was, it's okay to procure these things, it's okay to put them in, but I needed a level of aftercare sales support that was commensurate with the level of activity in our business, i.e. when I procured this, you might feel the same, it was my name all over it, and I didn't want to be associated with failure. So in terms of the success criterion, one of them for me was, whoever we procure to deliver this has got to be there for me personally once it goes in. I hope that makes sense to you. The company we chose above everybody else was a company called Totara. They were the designer, if you like, the manufacturer of the intervention. So we chose Totara because in terms of the criterion, and there were 10 specific criterion that we needed to be satisfied, Totara did 2 things. They either met the criteria or they exceeded the criteria. And that was very important to us. I had a budget from Virgin Care to deliver this. It really, honestly, wasn't the defining factor. It was a factor, but it wasn't going to be the determining factor. And the other thing I'll impress upon you is we wanted our site to look like Virgin Care. So you've seen some of the branding I used earlier on. We were very into, let's make this look like Virgin Care. Let's make this feel like Virgin Care. So based on all those criteria, we had discussions and we said, we think Totara is the best one for us. There were other solutions, but the thing I want to impress upon you again is this. Totara was offered by Chambury Learning Solutions, who are Chambury Learning Solutions. Can you just put your hand up? Are you here? Yeah, that's Richard, and there's Matt. Do talk to Richard and Matt afterwards, because they are basically the people that introduced us to Totara, and they were, for me, the reason we actually selected Totara. So in summary, Totara was good. It was definitely the best system, but not obviously the best system. My thing was, I need to work with an organization that I feel that I can trust and will support me and react to my needs. I'll tell you a little bit more about that in a few minutes. This is basically the front end of our solution. When I said I wanted something intuitive, I think I've got it. If you're doing your statutory and mandatory training and you want to know what your personal compliance is, when you log on, that's what you see. In all cases, you press the left-hand button and that will tell you, for these subject matter, you're compliant. For the additional subject matter, you're not compliant and you are non-compliant by 1, 2, 3, 4 months. You should have done it on this date. We wanted something really simple and really intuitive, and these 3 buttons give it to us. For all other training, in our organisation, that would be very much clinical training, vocational training, and management development. Go to the other 2 buttons if it's a face-to-face course, which most of it is. Go to the other button if you want the e-learning interventions. So that's how we designed it. When I spoke to Richard, I said, Richard, I need this to be really simple. The good thing he told me was that Totara can handle manipulation. It can be branded the way you want, and the pathways, the access to learning, can be designed around your particular needs. So I can confidently stand here to say, I had that conversation, I'm glad I selected Chambury, and I'm glad that that came with Totara. And that can look, if you're interested in buying either solution, that can look exactly how you want it to look with minimal amounts of fuss. I'm told that my team will be able to do that in the near future. We can't at the minute, but I don't think that's because we're not up for that idea, it's just we haven't got round to doing it. That's really useful. A little bit more about Chambury Solutions. I told you that Totara wasn't the clear winner. It was the winner, but there were other solutions. What we got with Chambury was the following. An organisation that understood our needs. And I put and concerns, because I share this with you candidly. When I agreed to lead the team to making this change, I was anxious and apprehensive about it. What they were able to do was say, tell me what your fears are, and they told me how they were going to deal with it. So when we're actually migrating our legacy data from System A to Totara, they led that. They developed the project plan, they supported us, they led us through the IT transfer, and they kept in regular communication with me personally. And in terms of customer service, I always say it's great when people pick up the phone. They pick up the phone to me every time and they sort my problem out there and then. Believe me, when you have responsibility for this transfer and the world and his wife in Virgin Care are watching you, it's great to have that level of support. And they've just won from Totara the Best Totara Project for Healthcare 2016. So it's not just me that's telling you this is a good organisation to work with. Did we get it right? We did. We did get it right. Our data, when we look back in System A, was not brilliant. It did need cleaning, and I don't think anywhere in the project plan when we started was a kind of line 3, cleanse the data. Chambury Learning Solutions got hold of that data and cleansed it for us. They moved it without any problem. Within weeks, probably about 8 to 10 weeks, we had our first cohort tranche of people logging onto the system. Cohorts 2 and 3 followed very quickly, and last month I can report that 86% of our 6,000 UK operatives had logged on. I don't know what that number is, there's probably about 5,000 something, I don't know, but people have a zest for it, they have a zeal for it. Now they know how easy it is to use, they're all logging on. So we haven't put a huge comms campaign around this, we haven't done a huge sell, it sells itself, and people tell each other within Virgin Care, if you want to get your training done, log on, it's dead simple, it's not like it used to be. I just want to share this with you. It might or might not be useful, but I'll just run through it anyway. The key thing about purchasing a learning management system is around the functionality. Write down brainstorm with your teams all the things that you want a learning management system to do, bar none. Then rank them 1 to 10 and use the 1 to 10 for your vendor rating. Put it in front of your vendors and say, can you satisfy these criterion? And out of 10, mark them against it. Get them to come in, pitch to you, test out the functionality that's being presented, and make sure it's exactly what you want. I've made the point already, but I'll reiterate. Make sure the persons, the organization that are supplying it are able to deliver exactly what you want, when you want it, how you want it, and ensure to the best of your ability, have the knowledge that they will be there after the transfer has been completed, when you go live with your LMS. It is so important. In terms of key stakeholders, make sure they're fully briefed. If there's something I could do better next time, I think it would be the stakeholder engagement. It was okay, but it wasn't a resounding success. I would definitely do that different next time. And as with all plans, so we had I think a fairly robust plan. There were things that came up that we couldn't deal with. That happens in projects. So my message is, when they occur, deal with them immediately, then re-communicate to your key stakeholders. So that's my key message today. I really hope that's been useful for you. It's give you an insight into my world last year. And I'm happy to take any questions from you. You'll need to shout them though. Just pop your hand up if you've got a question. Okay, Chambury Learning Solutions are here. If you want to speak to them, Richard's over there, Matt's there. Do engage with them if you need to speak with them. Thank you very much.